So, good afternoon. Welcome to another interactive session at Spring Meadows Hospital. I'm Preeti Raghav, your moderator for the day. For this session, we'll be discussing the problem of PCOD. So, let me take the privilege to introduce you all to Dr. Apurva Gupta, who's a senior consultant gynecology at the Spring Meadows Hospital.
Hi.
Hello, everyone. So, PCOD, the female reproductive system controlled by the complex interplay of primarily 5 of these reproductive hormones: estrogen, gonadotropin-releasing hormone, follicle-stimulating hormone, progesterone, and luteinizing hormone. When there is an imbalance within these hormones, it leads to a hormonal disorder called the polycystic ovary syndrome or polycystic ovarian disease, which is also known as PCOD, among women of reproductive ages. Polycystic ovarian syndrome or disease is a hormonal disorder that affects women in their reproductive age. PCOS generally affects teens and young women. In the childbearing age, it may be seen at least 1 out of 10 females. Some women start experiencing symptoms around the time of their first period. Signs and symptoms of PCOS may vary. In obese patients, however, the symptoms can be extreme. Some of the commonly reported signs and symptoms of PCOS include acne, darkening of skin, abnormal growth of hair on face and body, irregular menstrual cycles, polycystic ovaries, skin tags, thinning hair, and weight gain. So now I would like to ask Dr. Apurva Gupta. Ma'am, is PCOD curable?
Okay, so now Preeti, as you have already kind of given an introduction and you've already said that it's a disorder of hormonal imbalance. So before I tell you whether it's curable or not, I would just like to explain in a very simple language what exactly this imbalance is. So we just have to understand that among the set of hormones that you mentioned, we have some, say, good hormones and some bad hormones, right? Together, these hormones form a hormonal milieu. That's in a hormonal environment. So the ovaries of a woman respond to this hormonal environment, and in every cycle, of every menstrual cycle, that is, some eggs get recruited in the cycle. That means out of her bank of eggs, some eggs begin to become big. And one egg eventually overpowers the others, becomes big, and ovulates. So if she gets pregnant in that cycle, it's good. If she doesn't get pregnant, then she gets menses again. This is the normal cycle which goes on in any female's body. Now, because of XYZ reasons, primarily related to lifestyle, this hormonal milieu or the environment gets altered because the ratio and proportion of the good and the bad hormone changes. So once the hormonal environment is altered, the ovaries get confused. They don't know how to react to this new environment, as a result of which sometimes more than 4 eggs or 5 eggs will get recruited in a cycle, but none of the eggs will become big enough to rupture. So they get arrested in immature stages, and in ultrasound initially they would look like, small bags full of water. That's why we call them polycystic ovarian disease. Many cysts in the ovary. In reality, they are not really cysts, they are immature eggs, if we look at it that way, right? In a very simple language, a simple format. So, but we call it PCOD. So now this thing, so it can also cause anovulatory cycles. That means the egg is not released. It can cause fertility issues, and other symptoms that we see in PCOD are all related to this imbalance of hormones. Now, simple question, is it curable? So now we know why it occurs, because the hormonal environment is altered. So we need to change that hormonal environment back to the routine physiological hormonal environment. This can be done by supplementing hormones from outside. We have other methods also to tackle the negative hormones. Also, weight loss is a very, very important aspect of PCOD, because when you burn the female fat, certain enzymes are released which catalyze, you can say, the reaction of converting the back to good hormone. So weight loss, lifestyle changes, hormonal and non-hormonal other forms of treatment. Yes, PCOD is a monster which can be very, very, very reasonably curbed in today's times.
Mm-hmm. So this is curable?
Yes, in short.
All right. So ma'am, so as we all know that PCOS has a negative impact on health. Having higher than normal androgen level can affect not only your fertility but also other aspects of your health. PCOS has been known to be one of the leading cause of infertility in women. PCOS has been known to be one of the leading causes of infertility in women. To get pregnant, you have to ovulate. Women who don't ovulate regularly don't release as many eggs to be fertilized. So, ma'am, so I would like to another question. It is like, can a person with PCOD get pregnant?
Yeah, that's exactly what we were discussing even in the previous one. That often what happens is because of change of hormonal environment, there are anovulatory cycles. So none of the eggs is becoming big to rupture out. So in today's era, we have so many treatments, so many rungs of the infertility treatment ladder that I feel hardly any couple would ever be left childless. Definitely not in PCO. Most of the PCOs can be treated very easily, and most of the PCOs will conceive. Some of them may require just little help. Some require don't help at all, no help at all. They conceive naturally. Some require just little aid, little ovulation induction agents, some weight loss, and some parafertility therapy. Most of them just conceive by whatever little treatments. Some of them may land up in IVF. But yes, PCOD patients can definitely get pregnant. We have all ways and means to get them pregnant.
So, how can fertility be boosted in people suffering from PCOD?
See, first of all, this is something that one has to be aware of, and one doesn't need to just detect it when you want to become pregnant. You have to be aware of your PCOD status even before that, because often women or girls would just ignore irregular cycles, weight gain, signs of acne, hirsutism, because they don't really think it's that important till they reach that very point where they now want to produce children, and then they see the gynecologist and say, "Oh, doc, my cycles have always been irregular, say once in 3-4 months." So that is something that we should kind of be aware of, so that we always try to maintain regular cycles with or without treatment. And other symptoms, if you have of PCOD, see a gynecologist as soon as possible, so that you're getting the right treatment right from the beginning. Don't let the monster become big. You try to nip it in the bud, or at least control it, keep it well controlled, so that when you want to become pregnant, your body is used to the right hormonal environment, and it becomes easier for you to either conceive naturally and also for our treatment to act better. So the first point I think is to be aware of PCOD, to see a gynecologist regularly, to take treatment in time. Never let your weight increase. You must, even if you are within the BMI, which is the body mass index, you must make it a habit to regularly exercise and burn your fat. Because if you burn your fat, then automatically certain enzymes are released which catalyze some hormonal reactions and move the hormonal environment towards the good, conducive hormonal environment for the female body. And good lifestyle, sleeping in time, getting up early, avoiding junk foods, eating healthy, things which I think these youngsters' lifestyles, by virtue of maybe peer group pressure, and also because of by virtue of odd timings, that the world is becoming one place to work now. So odd timings of work. I notice a lot of patients have to stay up at odd hours, work at odd hours. So I think all these things are also contributing to an increase of a general incidence of PCO. So maintaining a good, healthy lifestyle, inculcating regular exercise in your schedule, recognizing that you may be a PCO, taking help in time, all these things that when you want to get pregnant, come for a counseling much before you are planning to get pregnant, so that a few things which may need to be set right here and there can be done till you reach the breaking point.
So now you have our viewers with us. So we have a question from Nidhi. Will my PCOD get cured with homeopathy treatment?
Okay, so here we are allopathic experts, so it becomes a little difficult to comment on that. There are a lot of homeopathy treatments available for PCO. Since we in particular wouldn't have much experience, and we're probably not the right people to tell you about whether homeopathy would work or not, but homeopaths do claim that it works, but I think they would answer. For us, we know allopathy does work.
Alright, so ma'am, we have another question from Bhavya Mathur. She's asking, my doctor suggested that pregnancy is the only cure for this problem. Is it true?
Okay, so now PCO is one disorder that we say does improve with pregnancies. We wouldn't say pregnancy is per se the cure, but yes, PCO is known to improve with subsequent pregnancies. So maybe that's what her doctor wanted to suggest.
Alright, so ma'am, Shimona is asking, hello doctor. Is it possible to get irregular periods with ovulation issues due to hormonal problems?
Is it possible to get?
Is it possible to get irregular periods with ovulation issues due to hormonal problems?
Yes, very much so. One of the important symptoms of PCO is getting irregular periods, which is why if you ever in your life get a period which is a deviation from your normal period, you must always see a doctor. May not be PCO, could be something else, could be simple stress, but you must rule out. You should never just pass it on as could be just one of a time.
Okay, wonderful. So, almost 80% of women suffering with PCOS are overweight or obese. Both obesity and PCOS can increase your risk of high blood sugar, high blood pressure, low HDL, or good cholesterol levels, and high LDL or bad cholesterol levels. These factors can lead to metabolic syndrome, causing disease like diabetes and heart disorders. So, ma'am, now I would like to ask you, what this can cyst be removed?
The PCO system.
Yes.
Yeah. So as we said, these cysts are basically like small bags full of water or immature eggs. And can cysts be removed? We have to decide whether we really want to remove them in that sense. So once we give regular hormonal treatment, a fixed number of eggs get recruited in the cycle, and one egg would ovulate every cycle. And this kind, once your cycle is set, automatically the PCO appearance on the ultrasound would kind of begin to regress. But for patients who are a higher grade or a higher severity of PCO, we often have to do something called as laparoscopic drilling of the PCO ovary, in which we make small, you can say a few millimeters holes in the cystic areas of the ovary. And technically you can call that as removing of cysts. But that's not done for all patients, few select patients which are suitable candidates for that procedure.
And ma'am, what should be eaten to curb PCOD?
As I already said, it's mainly a lifestyle disorder. Okay, so we have to maintain a general healthy lifestyle. You can't eat particular foods that would curb PCOD, but to maintain your healthy lifestyle, eat healthy food with low carbs, low fat, less junk. Okay. Now, I don't think anyone lives without junk these days. So I often tell my patients that Monday to Saturday, healthy food, Sunday you can indulge, just to make it more acceptable. But and a regular exercise schedule, concentrating a lot on fruits and vegetables, general healthy diet is what will maintain you towards a non-PCO path.
So, ma'am, another viewer, Mr. Shali, is asking, both my ovaries are slightly bulky. When can I conceive?
So appearance of bulky ovaries and getting pregnant, we also need to know what other symptoms you have. Just having bulky ovaries, it's difficult to comment on when will you conceive. If your other things are normal, your cycles are regular, there are no other issues, bulky ovaries shouldn't be a hindrance really.
And so Shimona is asking again, I also want to know that even after having a kid, my cycle is irregular due to PCOD. What to do?
Yeah, so as I said, PCO may improve with pregnancies, but need not necessarily be cured with pregnancy. I'm sure it's improved a little after her pregnancy. But I need to answer again.
Yeah, so she's asking, can I take an emergency pill if I'm taking medicines for PCOD?
Yeah, you can take an emergency pill, but if you're already on a hormonal contraceptive pill for PCOD, then you don't need the emergency contraception. And generally, a disconnected answer or disconnected from the topic, generally one should avoid taking emergency contraceptive pills because they are high dose of hormones flooded in that little pill. It should be taken just when you're absolutely in an emergency situation. Don't make it a routine contraceptive habit.
So the disorders like sleep apnea are more common in women who are overweight, especially if they also have PCOS. Yeah. During ovulation, the uterine lining sheds. If you don't ovulate every month, the lining can build up. A thickened uterine lining can increase your risk for endometrial cancer. Also, the body undergoes a lot of hormonal changes. These hormonal changes and symptoms like unwanted hair growth can have an extremely negative effect on a person's emotions. Many females suffering with PCOS can end up experiencing depression and anxiety. Ma'am, I would like you to bring some light on this.
So basically, this is a symptom complex, okay, which has got some symptoms which definitely have a negative body image kind of outlook. Like often girls with PCO would be obese, they will be hirsute. Hirsute means androgen distribution of hair, like male distribution of hair. So they may have like a more upper lip, thicker eyebrows, or maybe hair on the belly or around the nipple area. So these are things that girls, especially in adolescent age group and in the reproductive age group, wouldn't really appreciate. Yeah. So this is what practice of this negative symptom complex sometimes, and plus if you're not getting regular cycles. Okay? And also a PCO patient finds it more difficult to shed weight than a non-PCO patient would. So this PCO girl is regularly gymming much harder than her friend is, but her friend is shedding more kilos than she is. So all these things kind of add up, and definitely PCO patients, I would say, yes, are prone to a little anxiety, or I don't know whether to call it depression in the technical terms, but yeah, some of them may land up. So understanding of the entire disease, I think, is more important, because first step to improvement is awareness. So once you're aware of what's happening, then you seek help. And once you seek help, then things start going on the right track. So the vicious cycle of things not going right, feeling bad, then things still not going right, feeling worse, that cycle needs to break somewhere.
Absolutely. And ma'am, what is the link between a PCOS and diabetes?
Okay, so amongst the hormones that the PCO disturbs, it also disturbs the concept of insulin resistance. So it causes insulin resistance. So that means you need higher insulin levels for it to cause the same effect that a normal person, and X insulin would cause a particular reduction in blood sugars, whereas in a PCO patient, you need much higher insulin levels for that to happen. So this is also what happens. This change of physiology is also what happens in a diabetic patient. So for lay people terminology, we can say that PCO leads or PCO makes the patient prone to diabetes because it alters the insulin metabolism. So often patients will come with a higher fasting blood sugar or higher fasting insulin levels and more insulin resistance.
All right. So yet hope should never be given up. There are some lifestyle modifications that can help in curbing the effects of PCOS. Maintaining a healthy weight is a must. Weight loss can lower insulin and androgen levels, and many restore ovulation. Weight can also be managed by eating healthy food. A diet that is high in carbohydrates and fats may increase insulin levels. Along with eating healthy, it is also important that you exercise regularly. It helps lower blood sugar levels and control your body weight. So now we have a question from another viewer, Anita Mathur. So what are the lifestyle changes that can decrease the symptoms of PCOD?
Yeah, so we already spoke about this. So lifestyle changes, PCO is primarily a lifestyle disorder, and lifestyle changes, I would say, is the number one, if at all, any cure for PCO. So the number one lifestyle change is that you must inculcate exercise in your daily schedule. Say about 40 minutes of exercise daily. And I often tell my patients, if 40 minutes is too much for you, try for 20 to 30, but maintain a consistent exercise level, like a brisk walk, a jog, a treadmill, a swim. These are things which are important, because once you burn the female fat, you release certain enzymes which catalyze certain enzymatic reactions and improve your hormonal value. Also, exercise will control your blood sugar levels, as you also mentioned in your Sarita. So again, so number one lifestyle change is exercise. Number two lifestyle change is eating healthy food, avoiding junk, eating less carbs, less fat, less fried food, including fruits and vegetables in your diet, and deriving more calories via proteins versus carbs and fats. Okay, number two lifestyle change. Number three would be sleep habits. Okay, need to sleep early, get up early, avoid staying up late, because that also causes change of the circadian rhythm and the diurnal and the hormones in our body. And try to maintain as stress-free as you can be. So difficult in today's times, but we have to learn to manage stress, because stress is there in everyone's life. We have to learn to manage it. Because again, stress is an internal killer, and hormones are very, very delicately balanced in our body. So we take too much stress, emotional, physical, whatever type, and the hormones are beginning to get disbalanced. So yoga, meditation, general good healthy lifestyle will definitely improve your PCO as much as it can.
Ma'am, so I have another question, which is very much we have asked before also. So does oral contraceptive reduce the changes of getting PCOD?
See, oral contraceptive pills, in fact, is the first line of management or first line of treatment for a PCO patient. So we have oral contraceptive pills of different grades, high doses, low doses, of different combinations of hormones. So depending on which symptoms are predominant in which patient, we have to make a choice with the right oral contraceptive pill. And it's often the first level of therapy which is given to patients, that oral contraceptive pill for, say, 3 months or 6 months, because it's got multiple advantages. One, for patients who have irregular cycles, it sets the cycle, the clock cycle right. So every month she's regularly getting her period, so her body gets used to the right dosage of hormones from outside in the right manner, so the body learns to react in the right way. So yeah, as you said, are they useful? In fact, it's the first line of
First
therapy.
line of treatment. And the last question I'd like to ask, what are the treatment options for PCOD?
Yeah, so the first I said oral contraceptive. Apart from now, let's talk about treatment options apart from lifestyle changes because we've already spoken of that. So the first level of treatment is the oral contraceptive pills. Depending on the type of PCO, with symptoms which are prominent, we choose amongst an entire bag of oral contraceptive pills. 3 months to 6 months to 1 year is often what the patient would need to take. We have certain oral hypoglycemic agents like metformin, which are often given to PCO patients to improve their insulin resistance that we spoke about, or the diabetes-like picture. Okay, so that's also a line of treatment in PCO. We have some inositols which are being given these days. And if a patient needs to get pregnant and she's still anovulatory, we can give her ovulation-inducing drugs in which we give therapy so that the patient improves the egg production and she produces eggs enough so that she gets pregnant. And if a patient is not improving with all this and they really need to be treated, we may go in for a laparoscopic ovarian drilling. So there are multi-modes. So, and often we have to take more than single approach. So it's like a multi-pronged approach. Often a patient needs more than one treatment.
So there is one more question from Sita Gupta. Will my PCOD symptoms go away at menopause? Is PCOS and PCOD different?
Yeah, so this, I have to say, this question is PCOS and PCOD different. So PCOS stands for Polycystic Ovarian Syndrome. Syndrome is nothing in technical language but a complex of symptoms. And PCOD stands for